Hi there, welcome to Dr. Chen's Minor Ailments Forum. Earlier on I did a video to talk about tired all the time, and we briefly touched upon obstructive sleep apnea or sleep apnea. So I thought I would spend a few minutes just to expand this topic a little bit, jump on the bandwagon, just to talk about it. I think it's quite important and it's more common than you think in the community. So sleep apnea, the word apnea means a period of time there's no breathing or no breathing. So when you put two words together, it probably means when you're sleeping at night, you get period of times that you're not breathing. And you know, some of us, when we're sleeping at night, it's not abnormal to have one or two episodes of not breathing for a few seconds and suddenly have a big snore like that, and then come back, wake up a little bit and go back to sleep again. That's normal. But if it keep on happening on a really frequent level, and that's causing daytime symptoms, for example, falling asleep on the sofa, feeling tired all the time, you know, driving, you know, in a car and at a traffic light you feel like you're falling asleep, then these are dangerous and they need to be seen and diagnosed, really. So how do you know, or how would you suspect that someone's got sleep apnea? It's all about collateral history and the history of their own person, really. So so imagine you're looking at someone who's sleeping and you think that they might have sleep apnea. So the way that they would present would be, generally speaking, they snore quite a bit, okay? Just on a normal day when they sleep, they snore. And halfway through the night, suddenly they will go quiet, maybe for 10 seconds. And suddenly they would wake up, but really briefly, maybe with a really big snore or a snort, and then they go back to sleep again and return back to their normal snoring pattern. So that would make you think, oh, you know, could he or she be having sleep apnea? And if this happened, you know, several times during the night, I think if you know someone like that, you need to advise them to go and see the GP just to get it checked out, making sure they're not suffering from sleep apnea. Sometimes they, you know, if you're living on your own or no one has got a collateral history, you might not know that you're doing that kind of thing. But you might notice that you're just generally tired all the time, you sleep for hours, you never feel refreshed. And let's say if you sit on the sofa and watching telly, halfway through you will fall asleep, you never see the end of the movie, for example. Or if you are driving, and let's say driving is your profession, and you would feel that, you know, while you're waiting at traffic or at traffic light, you would feel like you want to fall asleep. And these are kind of the telltale sign that maybe there's something wrong with your sleeping pattern that needs to be looked into. So there are several, you know, stereotypical signs rather, or indication that someone might be suffering from sleep apnea. One, if they have got wider neck but short neck, or if they have thick tonsils or uvula, which is the dangly bit inside your throat, or maybe they are quite overweight or obese, or if they smoke. And these are the kind of several factors that generally put you at a higher risk of getting sleep apnea. So you can do something quite interesting, you know, off your own back if you feel, oh, I might have that problem, or I might know someone who has a sleeping problem, is to do a questionnaire called Epworth Sleepiness Scale, EPWORTH, Epworth Sleepiness Scale. So this test is basically all the things that not all, but some of the things that I mentioned earlier on. For example, like they say, do you feel tired while you're waiting at a junction, or do you fall asleep at a sofa? So they've got different frequency that you take, and at the end of the score it will indicate how likely you'll be having a sleeping problem. So I think it'll be interesting if you do that scale and you score quite high. It's definitely worth you to bring that to go and see your GP to have a further chat and investigate further, because you can imagine if you're tired all the time and if it's caused by the sleep apnea, potentially it can cause you know, problem at work or at school, and also it's quite scary if you don't breathe during the night, because potentially if it keeps on happening and the frequency is high, it might deprive oxygen to the brain, so that's not a good thing. So if you do suspect you might have sleep apnea, or you do know that someone might have that kind of condition, please make sure that you or them go and see their GPs for further advice. Okay, so this is how much I want to say about sleep apnea. Of course, there's more to say. One more thing, just want to talk about how, you know, if a GP suspects that you've got sleep apnea, how to go about from there is, generally speaking, we will refer you to a sleep clinic, and what they would do is basically film you sleeping, but with monitoring with wires and whatnot onto a machine to measure your oxygen level, how much you move about during the night, and they're very conclusive actually, these sort of tests, and I think, you know, it will be quite interesting to actually be there and see how it's done. I'm definitely interested of seeing how it's done, by doing so, they'll be able to tell, you know, your degree of sleep apnea and what kind of treatment you need. And if it's mild, sometimes you don't need any treatment at all. And in severe cases, quite a lot of people will need oxygen during the night when they're sleeping, in order to make sure that if they go into that kind of apnea episode, they will have enough oxygen inside the body to supply to the brain. Saying that, you know, if it's in a mild case, general measures are important. For example, if you're overweight, you might want to try to lose some weight. People who sleep on the back tend to have more problems, so maybe they have to learn how to sleep on their side, etc. So this is how much I want to talk about regarding sleep apnea today. Obviously it's a massive topic and there's loads more to talk about. Please stay tuned, and there'll be other topics coming up for your information. Thank you for now. Bye bye.